Hello and welcome to China Focus. I'm Keqiang. Saturday was World AIDS Day. In China, AIDS is a growing epidemic, and government officials there say it's promiscuity and drug use that's leading to new cases. But the #1 reason for AIDS in China remains covered up. Here today to talk about that issue, we have Keqiang and Matt Ganesta. So every year around World AIDS Day, we have government officials, like this year's Xi Jinping, Keqiang, come out and meet with people who are HIV positive, who have AIDS, to kind of reinforce that the government is doing something about AIDS. Is that the case?
That's what happened this year. Basically, at the start of last week, Keqiang, the person who's about to be premier, met with a lot of civil groups that support AIDS victims and basically promised them that the government will help them to do more to help AIDS victims. Wen Jiabao also met with healthcare workers, AIDS sufferers, and Xi Jinping did as well. So like you said, every year, basically, they've turned AIDS into a big public health campaign where the government is really seen to be doing a lot to help those who are suffering and also the health workers who are supporting them.
So it seems like they are making a big deal. They're making kind of an effort to control the AIDS epidemic and help people.
In the press, definitely that's how it comes across. You know, you have the leaders shaking hands and hugging AIDS activists. In China right now, there's a lot of discrimination against AIDS sufferers, and basically the government is trying to push this image where they are trying to teach the public about discrimination, about how to receive AIDS sufferers.
Well, you know, on this topic, on Friday, our Chinese call-in show Focus Talk, AIDS activist Hu Jia from China called in, and he was talking about, you know, Chinese officials like Keqiang coming out to meet these people, as Karen mentioned. And one of the things that's interesting is these aren't just like your average AIDS victims, and they're not the people who are suffering the most. As Hu Jia pointed out, these are people who have been pre-selected. They're most likely people who are already getting good medical care, and they're, of course, in the minority, but they're politically safe to go out. You know, they're not going to say anything wild. And they're basically, they look healthy, they've been on the antiviral drugs, and so this isn't really a representation of the AIDS situation in China. It's the politically polished version of it, when in fact the great majority of AIDS sufferers, the number of which is unknown, but it's probably higher than government estimates, they're suffering a lot more.
So let's talk about the numbers. The government estimate says about 490,000 people have AIDS in China, or HIV.
Well, they've registered that, and then the government estimates that it's about 780,000 as the estimate, even though not all there's 490,000 or so that are registered. But actually, even the government estimates are usually a lot less. Like every time there's a disaster in China, for example, the official government death toll or the government estimate death toll is usually much lower than what activists or other people on the scene report. So, of course, we don't know, but in this case, it's likely that that would be the minimum number.
So on Friday, Hu Jia was actually asked this question by our host, asking him how many people does he think are affected by AIDS. And basically he said, because right now the government is the one that's controlling the monitoring and the gathering of the data, only the government knows exactly what's going on, and these grassroots organizations, they can't do the independent verification. So for him, he said he doesn't know exactly how many there are, and he doesn't believe the government figures, and he puts the real figure at least 1 million people that are affected by HIV/AIDS.
1 million people who are affected by HIV/AIDS. That's twice the registered number of people. And one thing that you mentioned about the government estimates that seems a little scary is that 780,000, because the government believes that there are a lot of people who do not know that they have the virus.
Yeah, there's already a gap between registered and the government estimate. But again, the whole thing is still suppressed. It's still kind of a mystery because you lack some of the basic, transparency and education that we have here in the West regarding HIV/AIDS.
So is that changing at all with this kind of high-profile kind of government officials, like talking to AIDS groups and AIDS victims?
Well, there's still a lot of things that are covered up. And so part of this government show is to show what's polished on the surface, but then they're covering up. One of the major sources of AIDS in China is this sort of blood donation thing that happened in Hunan province in the early and mid-90s, where basically farmers were encouraged to donate their blood plasma, and they donated their blood. The plasma was extracted and they were injected back with red blood cells, but this was from a pool. So if there was HIV or AIDS mixed into that pool, then a large number of people contracted AIDS at that time. That was covered up quite a bit at the time, and the government and Communist Party still refused to really acknowledge the extent of this.
Well, I mean, all the officials that were involved in that particular blood selling scheme, none of them have been held accountable, and there's still a lot of hushing up of what happened. And basically, when Keqiang was meeting with the community groups last week, at the same time, about 100 AIDS sufferers from Henan that were victims of this blood selling scheme went to Beijing, and they wanted to basically make what they had been suffering known to the public, because they didn't get a chance to speak with the media, they didn't get a chance to meet with the leaders. Like Matt was saying, it's basically only the pre-selected groups that were towing the party line, saying, you know, the cause was from promiscuity, from drug abuse. Only they were allowed to get a meeting with the leaders. But these Henan sufferers, they basically, Hujia was saying that they were like about a mile away from Li Keqiang's office and trying to appeal, but they were taken away by authorities.
So the Hunan, I mean, it's been pretty publicized. People know, or there have been media reports about these AIDS villages in China, which were the result of this like blood donation, blood selling thing. But has the Communist Party acknowledged that that's a big cause of the AIDS epidemic in China?
Well, what's interesting is, you know, you mentioned Li Keqiang. Li Keqiang was actually governor and later party secretary for Hunan province. That was like the early 2000s, like late 90s. And then, but before him was Li Changchun, and Li Changchun has just retired, and he basically until November was the head of the basically spiritual guidance committee for building spiritual civilization. That's basically in charge of all the propaganda, and he was like the top guy in charge of propaganda for the Communist Party, and he was put into that position, you know, in 02. But that was before that he was. Or sorry, 07. Before that, he was in Hunan province during the main part of the blood scandal. And as the governor and party secretary for Hunan province at that time, he was basically the main guy who would have been responsible for it. But when you have someone who is such a powerful Communist Party official who's responsible for that, and then Li Keqiang also, because he came in, it was the successor in Hunan province. You have these two powerful officials from different factions, Li Changchun from Jiang Zemin's faction, Li Keqiang from Hu Jintao's faction. Both of them have some responsibility for this, and they both have an incentive to kind of keep it under wraps. And so there's no incentive to really reveal the extent of what happened in Hunan province. And even though we know about it from some of these you know, Western media or from dissidents in China who've talked about it, I think the extent of it we still don't really know.
I mean, it's not like the government hasn't acknowledged it at all. They have said that between 20 to 30,000 people were affected and infected with HIV from the blood selling scheme. But Gao Yujie, one of the main proponents of AIDS supporters, her estimate was that it was more than 1 million people that were affected. So while the government has acknowledged it, it's nowhere near the real scale of what the problem really is.
So let's go into kind of the history of the scheme a little bit. You know, you said, Matt, that Li Changchun could be held responsible, really, because he was in charge of the province at the time. But who came up with this, and how did so many people get involved in it?
So it was first started in 1992 by the head of the Henan province's health department, and he basically saw it as a way for people to get rich. It was a get-rich scheme. So he encouraged farmers to sell their blood. They would get about $6 US dollars each time back then for selling their blood. And so the government actually set up a lot of blood selling centers, legal ones, but then a lot of illegal ones popped up as well. And what they were doing was that they weren't switching needles, they weren't cleaning needles, so there was a lot of contamination of diseases, and HIV was one of them. And to also increase their money making, they would sell the blood back, like Matt said, to the people who donated blood. So this was basically what generated all the big outbreak.
Right. So, and the people who were, you know, actually running the blood schemes were able to make money from that too. Obviously, that was the incentive, not just to help farmers make money. Mm-hmm. So that's why you had illegal ones popping up. So, you know, again, you have these like money on both sides. So incentive for farmers, incentive for the blood collectors, whether legal or illegal, and you can always make more profit by, you know, cutting corners when it comes to, say, cleaning or using fresh needles.
And the farmers really weren't aware of the risk that they were putting themselves into by doing this.
Because the education, you know, about HIV was basically non-existent at that time. It's still very, very limited.
So almost 20 years on from when that blood selling scheme started, what's the situation for these people in Henan province? You mentioned, Karen, that they were trying to go to Beijing to, you know, petition Li Keqiang. So that seems that they're still in a pretty desperate situation.
Well, because the problem, like Matt was saying, involves two of the senior leaders of the Communist Party, they unless they can address these issues properly, but they will have to basically implicate them and expose what they did. So the victims in Henan province, they're basically kind of this ignored group. Right now, the government is saying, we are educating people about how not to transmit the disease, but these people who were infected during that time, they basically have no recourse, and that's why they have to go to Beijing to appeal on these big days for AIDS.
So are there solutions for the AIDS issue in China?
Well, really two things. One is transparency. Transparency by the government of exactly what's going on everywhere and the real causes of AIDS and how it's being spread. And the other is education. There's extremely limited health and sex education in Chinese schools. It's basically not talked about. That needs to happen in terms of helping people at a younger age understand the risks. And if they could really do those two things, that would probably make a big difference moving forward.
So transparency basically across the board.
Well, yes, I think across the board is a key point. Li Keqiang and other senior leaders were meeting with selected groups of AIDS supporters, but in the West, the people that were most known about supporting AIDS activists like Hu Jia, like Gao Yujie, and also Wan Yanhai, basically they've been targeted by officials because they were the ones who were raising awareness about what happened in Henan province. So to really solve the problem is not just selecting publicity to people who follow the party line, but really everybody that's looking into the problem and looking for the real cause of the problem.
So what happened to Hu Jia? Was he able to kind of come out and raise awareness about AIDS?
Well, he's actually been put under house arrest for the past month or so before the lead-up of the 18th Party Congress. When he was speaking to our reporter on Friday, he believes his phone was still being tapped. So even right now, he's still putting under a lot of pressure, and he hasn't been able to go to Henan province to look for himself because of the situation that he's in.
Thank you both for joining us to talk about the situation in China, and thanks for watching. For more on this and other topics in China, join us at ntd.tv.